Hello, my name's Tania Jones. I'm going to be completing the eye exam today. Before I touch the patient or go into the room, I would wash my hands and make sure that I'm ready and prepared to come in. Hello. Hi. My name's Tania. I'm one of the nurses here. What's your name?
Naida.
Naida. Well, your mom's right outside and she said that I can do this eye exam for you today. Have you had an eye exam before? You never gone to the eye doctor? I think your mom said you went there one time when they shine lights and stuff like that in your eyes. Yeah, so I'm going to do something similar. I'm going to be looking in your eyes or testing to see if you see my wiggly fingers when you see them. And then at the end, I'm going to shine some lights in your eyes, okay? It might be a little uncomfortable, but it's only going to be brief, okay? So I'm trying not to hurt your eyes, okay? But it's important for us to see what's in your eyes. Your mom said you've never had any surgeries or anything like that, okay? Right? Right, perfect. Can we first start off with looking at her symmetry of her eyes, and then just seeing what the eyes are looking like. They look symmetrical. She has some frequent blinking that I can see already. Are your eyes irritated?
I have to blink every second.
Okay, you have a lot of, do you do a lot of swimming? Yeah. So I don't see any abnormalities of the eyelashes, any crust, or anything going on with the eyelashes. They look nice and healthy. The eyebrows look nice and healthy. They look symmetrical. I don't see any issues with the tear ducts visually. And just a little pinkish on your sclera. A little pinkish in your sclera is what I see. A little bit, maybe due to all of the swimming you do. Are you part of the swim team? You do? How many?
I'm on bronze, and bronze is like more like swimming, and I also don't really wear goggles that much.
Oh, so maybe we need to get you some better goggles, huh? Or maybe some eye drops for freshening up your eyes. I'll tell your mom about that, okay? So first of all, I'm just going to show you this quick little graph. Have you seen this before? Yeah, so I'm going to check and see what is the lowest line that you can read for me here?
Which line?
Which is the lowest line you can read? Clearly, which line can you see and read? Can you read this one?
C, F, D, H, J.
What about this one?
L, T, F, P, H.
Perfect. And that's a 20/20 vision. So that's good to see that you're able to read the letters on this graph for me. Now I'm going to look, I'm going to sit down really quick, okay? And then I'm going to do something along with your eye movements, okay? First, I'm just going to pick up this flashlight, and I'm just going to have you just look at the flashlight, okay? When it's moving, don't move your face like this, just your eyes, okay? If you want to take your shoes off to be more comfortable, that's okay.
Oh, is this great?
Okay, so just look at that flashlight and don't move your face, okay? So move, perfect. Can you try to keep your eyes open? Nice. Can you follow? Okay. All right. So I see that you're following the light, flashlight. Don't move your face. Your eyes are still blinking a lot, but you're not, you have symmetrical eye movement, okay? And I don't see any nystagmus or any flickering of your eyes moving back and forth. They're moving both at the same time, and they're symmetrical in that way, okay? So just keep an eye on this still, okay? And just follow the light, follow the flashlight. Follow the flashlight. Okay, so can you, I'm gonna start by looking at your eye vision around, okay? So I'm gonna have you cover your right eye, okay? And I'm gonna cover my right eye too, okay? And so when you see the fingers coming in your eye that you can see it, when you see them wiggling, can you tell me yes? Okay?
Yes. Yes.
No, keep looking at me.
Yes. Yes. Yes.
Look at me. You see?
Yes.
It says,
No.
you don't see?
Yes.
Yes. Okay. Okay, freshen up your eye a little bit. Now we're going to cover the other eye. Okay. And we're going to do the same thing, okay? Tell me when you see my fingers. Just look at me. Yes? Okay. You have to say yes.
Yes. Yes. Yes. Yes.
Okay. Perfect. Any blurry vision? Does it see blurry
A little bit.
when you were doing that exam? Okay. What about double? Do you see two of me when you did that? No? Okay. Is it okay if I shine some light in your eyes? I just want to look and see how they react, your eyes, to light. They're, you know, they shrink when they see light. Are you okay if I do that really quick? Okay, so look up a little bit. Okay, I'm going to shine some light. Nope. Open your eyes. Open your eyes. As wide as you can. Nice. Okay. I'm going to do this one. Nice. So I can see really fast. Your eyes are about a size 3, and they're round, and they moved really brisk when I shine the light, okay, which is a normal reaction of your eyes. So now I'm going to do it with both. Just going across. Oh, open. Okay, I can see both of them doing the same symmetrical. They reacted at the same time, okay? Now I'm going to do something different, which is I'm going to have you cover one eye, and then you're going to just look at me, okay? And then you're going to take off the hand from your eye. Okay, cover again. Let go. Okay, cover again. Let go. One more time, cover. Let go. Nice. So they're both, they're not deviating when she's covering her eyes. So they're both staying symmetrical when she uncovers it. So I don't see any issues or with the cover, not cover test. Let's do the other eye. Okay. So look at me. Uncover. Okay. Cover. Uncover. Okay. Cover. Uncover. Nice. One more time. Cover and uncover. All right, nice. So the same thing. I don't see any deviation of the eyes or one rotated out or in. They're both symmetrical and they're staying at the same position when we do this test, okay? Now, just looking, can you pull your eyelids like this so I can see inside your eye really quick? Okay. So I don't see. Do you mind if I put a little bit of light so I can see a little bit closer? Look up. Okay. I just see a little irritation in your eyes. So I think it's because you swim a lot. Ever since you started swimming, does it hurt your eyes now?
Well, yeah, a little bit.
All right. So maybe we can see what we can do about not having your eyes irritate so much from the bleach water when you do a lot of swimming. Okay. So let me do a couple more last minute things, okay? So that I can finish up really quick and then talk to your mom, okay? So let me look at using this little piece of equipment, okay? Have you seen this before? Your mom said that you did when you went to go see the eye doctor. Maybe what they do is they use the machine where you get really close to a machine and you stay like this, and then they shine a light in your eye. But now this is going to be me shining the light in your eye, okay? So what I'm trying to look at, see the little light there? It's going to look at your inside of your eye. Isn't that cool? That I get to see inside your eye. So I want to see what's inside your eye, all of those blood vessels and the nerves that go in your eye, to make sure there's nothing damaged there, okay? So for this part, we're going to dim the lights a little bit.
What happens if something is broken?
Well, if something's broken, we're going to send you to the eye doctor so that they can make really good tests to make sure that everything's running good, because I want to make sure your eyes stay healthy. Okay, but I just want to see right now. So I'm going to get a little close to you. It's going to be a little bright initially, but you see there's a little light there. See how it changes? I'm going to put this in your eye so I can see. So I'm going to get a little close to you, okay? So first, just always keep an eye on, is it better if you look right behind me? Can you keep an eye on that vase? Okay, don't move. Just keep an eye on the vase while I look. Okay, I'm going to look at your right eye first. Okay, and look at your red reflex test. Can you try to keep your eye open? Okay. Okay, so it's positive for the red reflex test. I can see. There's the red. Open your eyes a little bit. A little bit of yellow and orangey. I can see that really clear on your right eye, which is normal. Okay, I'm supposed to see red and orangey colors. Okay, it's kind of like, have you seen a picture and sometimes the eyes look really red in a photo? Okay, so I'm going to look at your left eye really quick, okay? So do the same thing. I'm sorry to bother you. In the light, just keep your eye open. Open your eye. Open your eye. Okay, and I see the red reflex test positive. Oh yeah, and I see red, a little bit of orange in there. Okay, you want to, I know it's not comfortable. There's only one more piece left for me to see, is when I get really close to your eye and I try to see right behind there, okay?
How are you going to do that?
I'm just going to get as close as I can. So I know that a light is going to bug you for a second, but I really just need to see back there really quick, okay? Okay. So I'm going to try to be as fast as I can, okay? So... hold on a second. I'm going to do the left eye first. Perfect. Okay, hold on. Just keep an eye on. Keep looking up. Nope. Look at me. Look at the light. Look up a little bit. Oh, there. Okay. Sorry. Okay. I'm trying really hard to see. I see some of the, I can see the optic nerve in the disc really briefly, because I see that it's irritating her. But I can briefly see that it looks healthy and normal. I don't see any broken vessels or any abnormalities briefly that I can see with what I can see. Can I try that other eye really quick? It'll be fast, okay? So I'm going to try to look at her right eye. Okay. okay? Just keep looking, okay? Just keep looking straight. All right, right there. Right there. Okay, sorry. So, and do you need some tissue? Okay, here, let me try to find you some tissue. I don't see, again, I see the optic nerve and the optic disc, and they look healthy and normal with the reddish, orangey around. And I don't see any broken vessels or any issues back there. Let me just make sure I've done all of the stuff that I need to do before I let you go back to your mom. Any questions so far of what I've done?
So whenever you put that in my eye, I kind of saw the glowy circle like over here. Whenever it was there, it like was far away.
Oh, I see. Well, I know it bugged you, but hopefully it didn't bug you too much. You did really great. And any questions and stuff, I'll address with your mom, especially the issue with you swimming and your eyes getting irritated, okay? Because I can see they're a little irritated. But I'll go back and talk to your mom, and then everything else was good. So thank you for taking the time for allowing me to do your eye exam, okay? You have a good rest of the day. All right, bye. Bye, Naida.